Vaccine mandates are in full effect here at SickKids Hospital, and while the vast majority of staff have been vaccinated, the hospital says nearly 150 staff members have been placed on unpaid leave. The day has come. Staff at the hospital for sick children need to be fully vaccinated. Those who aren't placed on unpaid leave. The hospital says just over 98% of its workers are fully immunized. For the 147 staff members who are considered unvaccinated, almost 20% have already received one dose. SickKids isn't the only hospital that's mandating vaccines for staff members. University Health Network says anyone who doesn't show proof that they have been fully immunized by October 22nd will be fired.
Ontario's doctors and the OMA have actually called for mandatory vaccine policies in the healthcare workspaces for quite some time. And ultimately, we know that vaccines are the way out of this. They're safe, they're effective, they help to restore capacity in our healthcare system, and we continue to advocate for everyone who is eligible.
As of right now, the province's policy requires all hospital staff to be fully vaccinated or undergo regular testing. But some hospitals have gone above and beyond and have made vaccines mandatory.
By going above and beyond the government order, they are opening themselves up to liability for wrongful dismissal claims.
Last week, the Premier wrote a letter asking for input around mandating vaccines for healthcare workers. And it brought up questions around the potential of staff shortages if a vaccine mandate were put in place.
The vaccine is only preventing approximately in both of our unions a possibility of 2% of the membership not staying because of the vaccine.
SickKids says they don't anticipate this vaccine mandate will create any staffing issues within the hospital. The unions representing healthcare workers say there are other issues that could pose staffing challenges.
And they're suffering from burnout and PTSD, safety in the workplace, violence in the workplace.
There's a dramatic increase in the number of people who are just packing it in, who are saying, I'm not going to do this anymore. And the number of resignations far overshadows the numbers of people who are going to lose their jobs potentially.
Now, we have reached out to UHN and Toronto East Health Network about vaccination uptake amongst staff, but we have not yet heard back.